Hi friends, I am Dr. Rajeshwari Reddy. I am a gynecologist, obstetrician and a laparoscopic surgeon working at Hyderabad. So today we will be talking about oral contraceptive pills, which is a birth control pill. So these are of two types. One is the regular contraception that couples use to maintain contraception for a long time, and there is also something called emergency contraception. In this video, we will talk only about the regularly used oral contraceptive pills. So oral contraceptive pills are very popular because they are easily available, they are cheap and very easy to use, and the whole control of contraception is in a woman's hand, and when used properly under the guidance of a gynecologist, they are more than 99% efficient. So what are these oral contraceptives? Oral contraceptives consist of two hormones. One is estrogen and the other is progesterone. It can be a combination of estrogen and progesterone, or it could just be only progesterone, which is also called a mini pill. So how do these OCPs act? First thing, they inhibit ovulation. So when there is no ovulation, there is no question of pregnancy. The second method is they make the cervical mucus very thick, thereby inhibiting the movement of the sperm from the vagina into the uterus. And the third method is they thin out the inner lining of the uterus, which is called endometrium, which makes it unfavorable for contraception. How do we use these pills? Some of the pill packets contain 21 tablets and some contain 28 tablets. The 21 tablet packet has to be started on the first or second day of the menstrual cycle. So when some people also have 1 or 2 drops of bleeding or little bit of brownish discharge just premenstrually, so we do not consider that as the first day. The first day of the cycle would be the free flow of the blood. So that is counted as first day, and this packet can be opened on first or second day of the cycle. So you start taking pill in a serial order as marked by the arrow for 21 days around the same time of the day, preferably after dinner for 21 days. And once you are done with the pills, you take a gap, and in the gap of 5 to 6 days, you are likely to get your next period. So when you get your next period, again you open a new packet and start the packet from the first or second day of menses. So in a 28-day packet, although the first 21 pills are just the same as the 21 pill packet, we give 8 tablets of multivitamin, which is just a placebo, so that there are people who can't remember this 21 days and 7 days of pill free. So for them it is easier that you just keep taking the packet and you finish with the 28th day, and then you get your menses, again you started from the first day. But otherwise it is 21 day of hormone pill and 1 week of pill free period, or in 28 pill packet it is 3 weeks of contraceptive pills and 1 week of placebo, which might be just a multivitamin. What happens if you miss one pill in a cycle? If you miss one pill and remember it the next day, take the pill as soon as you remember that you have missed the pill. Or on the following day, when you see the packet and you realize that you have not taken the pill the previous day, you take 2 tablets on the same day. You cannot afford to miss more than 2 times in one cycle. If you miss more than 2 times, then efficiency of the pill comes down, and then you may have to use a alternative as in condom for that particular cycle. But even then you cannot discontinue the packet. You must continue the remaining of the tablets and finish the cycle. And if you miss more than 3 pills, then this becomes a little tricky situation where the efficiency comes down by less than 50%. So do not rely on the packet for your contraception method. So what is the success rate of oral contraceptive pills and progesterone only pills? The efficiency would be more than 99% if it is used properly, as I explained earlier. So there are some side effects of the pill, as in dizziness, nausea, vomiting, breast tenderness, or sometimes breast pain. There might be breakthrough bleeding here and there, and very little weight gain. And some people also have some amount of acne, hirsutism, and bloating sensation. But all these side effects are very temporary, because as you get used to the tablet, then the symptoms slowly, gradually disappear. And when the symptoms appear, we also give other tablets to combat these symptoms. So there's no very serious side effect of the oral contraceptive pill. So what are the contraindications of the pill? First things first, without a period, you cannot start the oral contraceptive pill packet, and you should never start oral contraception within 6 weeks of delivery. And it is also not advisable for chronic smokers or people who have hypertension or any kind of cardiac diseases or deep vein thrombosis. So such people should definitely consult their gynecologist before they start the oral contraception. So when does the fertility return? In general, within 3 months of stopping the OCPs, like if you have used a OCP say for 2 years or 3 years, and then now you want to plan for your pregnancy. So you stop the oral contraceptive pill, start taking folic acid, and generally within 3 months, the ovulation gets back to normal. So there are also many other good uses of oral contraceptive pills, as in hormonal disorders where we use it to regularize the cycle, and abnormal uterine bleeding, dysmenorrhea, protection from endometrial and ovarian cancers. So there are also many good things about the oral contraceptive apart from being a contraception. OCP gives protection only from pregnancies and not from sexually transmitted diseases. This is very important for people to understand, that you have to protect from pregnancy as well as sexually transmitted diseases, especially when you are married or you have multiple sex partners. So let us understand some myths of oral contraceptive pills. Does it cause infertility? No, it doesn't cause infertility at all. Does fertility return to normal? Yes, within a period of 2 to 3 months of stopping the oral contraceptive pills, fertility returns to normal. Does it affect the sexual life? No, it doesn't affect the sexual life at all. Should I use it in safe period also? Yes, you should continue using in safe period also, and you shouldn't discontinue the OCP pill in between. Even when you have a breakthrough bleeding or any other cause, you must complete the packet. Do oral contraceptive pills cause weight gain? Minimal weight gain is expected, but that's not more than 1 to 2 kgs in a year. Do oral contraceptives cause defect in baby formation? Is a big myth. No, it does not. If you have used and stopped and then conceived, this has no bearing on the embryo. Next is the progesterone only pill, which is also called the mini pill. So when to use a mini pill? Lactating mothers, cigarette smokers, women who are about 35 years of age, patients having risk for thromboembolism, very obese patients. These are all ideal patients for using a mini pill. Some patients say that they don't want to use hormonal pill. So we need to justify using oral contraception and then decide regarding the usage. So one must also understand that the progesterone and the estrogen that are used in the oral contraceptive pills are actually normally present in our body. Another thing which patients keep asking me is, why should it be taken at the same time or at a regular time every day? So women's body undergo a lot of hormonal changes on a day-to-day basis and even through the day. So to just maintain the regularity, it has to be taken around the same time, not exactly pinpoint at the same time. The discovery of oral contraceptive pills has been a revolution in the world of contraception, because this method brought complete control of fertility by women. So the woman has complete control on till when she wants to use the contraception. Thank you.